How to assess a child with diarrhea. According to the World Health Organization, diarrhea is the second leading cause of death and a leading cause of malnutrition in children younger than 5 years. It is preventable and treatable. As a community health worker, you may see sick children with diarrhea in your community. By learning more about diarrhea, you'll have the knowledge and skills to prevent and treat it. So, what is diarrhea and what generally causes it? The commonly accepted definition of diarrhea is the passing of at least 3 loose or watery stools or poos in 24 hours. This is commonly a symptom of a bowel or intestinal infection and can be caused by viruses, bacteria, or parasites. How is it spread? Diarrhea is mostly spread through food or drinking water that is not clean, or from person to person due to poor hygiene, such as not washing your hands. What are the effects of diarrhea? Diarrhea can cause dehydration as the body loses water, salts, and minerals and does not have enough fluids to work properly. If this is not treated and it is severe, the child may die. Diarrhea that continues can lead to malnutrition. Children who are either malnourished, do not have a good immune system, or are living with HIV have a higher risk of diarrhea, which can threaten their lives. What can you do? When you see a child with diarrhea, you can assess whether the diarrhea is a sign of a mild or severe illness. You can then decide on the best actions to take care of the child. This video will focus on how to assess a child's signs and symptoms if they have diarrhea. Look out for another video in this module that explains how to advise on the best care for the child based on this assessment of their signs and symptoms. Begin your assessment by asking the caregiver questions about the child's symptoms so that you can understand how severe they are. Number 1. Find out more about the history of the diarrhea. You can ask, has the child had 3 or more loose or watery stools or poos in 24 hours? If the child passes stools often, but they are normal formed stools, this is not diarrhea. For how many days has he had diarrhea? Most diarrhea stops on its own after 3 to 4 days, but diarrhea for 14 days or more is a danger sign. It is also a serious sign if the diarrhea has led to severe dehydration and the child cannot drink enough liquids. Is there blood in the stool? Check that the caregiver understands that blood in the stool can look like bright red streaks or a black ink-like color. Diarrhea with blood in the stool, with or without mucus, may be caused by dysentery and needs to be treated. Number 2. Find out if the child has symptoms of dehydration. You can ask, is he able to drink or feed? How much less is he drinking than normal? Is he urinating less than usual, or is he unable to make urine at all? Is his urine a dark color? Is he tired, sleepy, or weak? Can he make tears? Diarrhea can cause the body to lose more fluids than are being replaced. If this is not treated, severe dehydration can result in death. A good rule to remember is that a child should urinate at least 4 times in a 24-hour period. If they are urinating less than this, they may be dehydrated. Number 3. Find out if the child has other symptoms. You can ask, does he have a fever? Is his stomach painful or swollen? Does he have a headache? Is he vomiting? An intestinal infection can cause gastroenteritis, which is inflammation or irritation of the intestines. This may be due to viruses or bacteria and can lead to these symptoms. Lastly, number 4, find out if the child has been exposed to an illness. You can ask, is anyone at home sick? Has anyone around the child been sick lately? And how long were they sick? If the child is in contact with someone who is sick, they may get infected too. If others in the household have similar symptoms, it may mean that the diarrhea is caused by an infection that is spread from person to person or by contaminated foods. Has the child been tested for HIV, or is he living with HIV? Children living with HIV are more likely to have severe inflammation of the intestines. The answers to these questions will give you a lot of information about the child's symptoms. To fully understand how sick the child is, you also need to look at the child's signs. Start by looking for signs of severe dehydration. Look for signs such as sunken eyes. This is when the area around their eyes looks hollow and dark. A fast heart rate. Feeling tired or weak. Not able to make tears. If you pinch the skin on their stomach, it stays pinched and does not flatten back to its normal position. Severe dehydration is a serious sign that needs urgent treatment. Then, look for signs of viral infections. Diarrhea can commonly occur as part of a viral infection. Look for a runny nose, a cough, a fever, swelling of both feet. Once your assessment is done, you should have enough information to decide if the diarrhea is a sign of a mild or severe illness. If it indicates a mild illness, you can help the caregiver care for the child at home. However, if it indicates a severe illness, you should refer the child urgently to a health facility. This process will be explained in more detail in another video. By doing a proper assessment, you can take the necessary steps to make sure that the diarrhea is treated correctly and quickly.